innovation and scaling tested solutions. How can philanthropy unite, bridging sectoral divides by spotlighting the plastics crisis and its impact on human and planetary health? To answer and explore these questions today, I'm delighted to be joined by a panel of experts in the field of plastics and chemicals, coming from the perspectives of healthcare, funding, and action. And I'm delighted to introduce Josephine Frame, the Green Perinatal Clinical Officer at Healthcare Without Harm Europe, Tamara Matalan, the Program Director at the Flotilla Foundation, Siobhan McCarthy-Morton, the Grants Manager at the Savitri Trust, and Yuyun Ismawati, the Co-Chair at IPEN, which is the International Pollutants Elimination Network. Before we jump into the main event, just a few housekeeping notes for everyone who's with us today. Please go ahead and say hello in our chat, which you should be able to view on the right-hand side of your screen. And we will also be taking audience questions today, which you can put in the Slido app, which you should also be able to see on the right-hand side of your screen or in the bottom right. And you'll also be able to upvote questions that you are particularly interested in. So have a look at that later on. Everyone who is attending this event today is entitled to a 20% discount on any Alliance subscription, which will give you access to exclusive subscriber content, 4 issues of the magazine a year, and free access to all future events. And you can find a link to our subscription page in the chat now. And we'll also be following up by email after this event with the offer and a recording. So now on to the main event. I want to turn first to Joe. Plastic and chemical pollution isn't just an environmental issue, it's a health issue. Can you talk a little bit about your work at Healthcare Without Harm Europe and tell us about the evidence that exposure to toxic plastics and chemicals has on our health? I think you're on mute, Joe.
There we go. That worked? Lovely. Yeah, thank you for the introduction. So yeah, lovely to be here. And basically throughout, to give a bit of context, throughout my midwifery career, there's always been 2 things that have been really important to me. Firstly, as a clinician, doing what I can to help women and birthing people I care for have the safest pregnancy with the healthiest outcomes for their babies in order to give their babies the best start to life. And since the beginning of my training, the significance of the first 1,000 days, which is from conception through to their 2nd birthday, has always been highlighted as the most important period of life where the foundations for future health are formed. Growth and development happen at the fastest rates during these 1,000 days, and the environment that a child is exposed to, from the microenvironment of being in the uterus to macro of the air quality of their hometown, can affect their development and lifelong health. So getting care and health right during pregnancy, during birth, as a midwife helps establish those early days where a baby's adapting to life outside of the uterus and as they grow throughout their early years. And then secondly, health equity has also been a personal priority. Globally, women and children are one of the most vulnerable groups for health inequalities. And it presents differently in different cultures and economies, but learning about the health impacts of climate change specifically on childbearing was what led me to working in healthcare sustainability. And at my organisation, Healthcare Without Harm Europe, we've got 3 particular programmes of work: Climate Smart Healthcare, Greener Pharma, and the programme which I'm based in, Circular Healthcare. And for us, the mission, as shown there, is to reduce healthcare's reliance on natural resources and help this facilities to support the adoption of circular practices and reusable items, and thereby reducing exposure to toxic chemicals found in many products and reducing the planetary health impact of healthcare services. And personally, I used to believe that the problem with plastics was just the environmental impact, the fossil fuels, single-use and disposable culture many of us are accustomed to, as well as the improper waste management at the end of life. And while that's still true, I learned there's risks with plastics that are a little bit closer to home, because plastic itself is not an inert material, and if anybody has ever had a food container that has either warped in shape, become opaque or discoloured, then this is showing how the integrity of the material can be compromised and affected by things such as heat, contact with fats and acid, for example. But it doesn't just happen when a plastic has been used too much or for too long. The integrity can degrade from day one. And physically, a plastic product can shed micro and nanoplastics. And for a human, these can get into our body commonly through inhalation, digestion, and even absorption through the skin. And plastic has been found in lots of different types of human tissue and organs, and even in amniotic fluid, which means that babies are being born already pre-polluted and exposed. And the research of the health impacts of plastics physically being in the body is still generally in its infancy, but studies have found that micro and nanoplastics can trigger inflammatory biomarkers, they can obstruct blood vessels, they can disrupt cellular function, and all of these small actions can lead on to significant health problems up to and including cancer development. And for pregnancy, research is finding that plastics within the placenta can have similar health risks to smoking in pregnancy. And the micro and nanoplastics can obstruct the transfer of oxygen and nutrients to the baby, and that can lead to growth restriction problems, and that can then increase the need for more medical interventions and therefore putting more pressures on healthcare providers. But in order for plastics to be manufactured and adapted for all the different uses that they have and to be made soft and flexible, transparent, it often requires synthetic additives to be used as well in the manufacturing. And there are thousands of synthetic chemicals, but a large group known as endocrine disrupting chemicals are the most concerning. And the research of the health risks that the endocrine disrupting chemicals pose to human health is a huge field that has been in place for over 20 years. So EDCs such as phthalates, bisphenols, PFAS, more commonly known as forever chemicals, are the most concerning to human health. They affect the endocrine system, and the endocrine system basically regulates all bodily functions from regulating temperature, blood sugar levels, hydration. All hormonal activity is controlled by the endocrine system. So chemicals that are then affecting the endocrine system can lead to more health issues and putting even further demand on healthcare systems. And if we think about vulnerable stages of life, here are some of the studies specifically looking at pregnancy and baby exposure and the health impacts it can have. But as I said, we need to think about babies during their formative first 1,000 days. Exposure to these chemicals can significantly affect their development. And throughout healthcare settings, we have become used to relying on plastics, and especially single-use plastics, with a lot of unawareness of the toxicity risks that they do pose to our patients. So in 2023, Healthcare Without Harm Europe launched Born Green Generation, with the mission of removing as many unnecessary plastics as possible in maternity, neonatal and paediatric care settings, and introducing reusable devices made with safer materials, thereby reducing exposure for our most vulnerable patients. And we partnered with 4 healthcare providers across Europe initially, and we've helped enable their maternity and paediatrics teams to deliver care differently with fewer single-use plastics and fewer endocrine disrupting chemicals in the products that they do use. And to date, there's been incredible achievements for the practice changes. And these successes have proved that we don't need to rely on plastics as much as we currently do. And it's also inspired a lot of other organisations as well. So we currently have, we're supporting an additional 15 more healthcare providers in adopting Born Green Generation. And we have had interest from 30 more organisations from around the world who all kind of see the potential, not just for the environmental benefits, but also to improve their health outcomes and to deliver care in a more conscientious way as well.
Thanks, Joe. Lots to think about there. And as a mother to a 2-year-old myself, lots to worry about. But before we sort of get back into dissecting some of the healthcare impacts, I want to talk a little bit about the funding landscape for this issue. Plastic isn't cheap when you take into consideration the cost of its production and disposal. The OECD estimates that $2.1 trillion will be needed between 2025 and 2040 to tackle plastic pollution as an issue. However, the amount of funding that goes towards this issue is in the millions, which is a tiny fraction of the need. So, Tamar, I want to come to you next. Can you tell us a little bit about your work at the Flotilla Foundation and why plastics and chemicals is a priority area for you as a funder?
Absolutely, and thanks for having me. Um, Flotilla is an ocean conservation foundation. So we are our mission is to preserve and to protect the oceans. One of our main issues is tackling ocean pollution, and that was the sort of the gateway for us to look into this issue. As we know, plastic pollution in the ocean is a very big problem. And we, just like anybody else in the world who has seen those images of plastics in the ocean and has heard those statistics of very soon we will have more plastic in the ocean than fish, became very concerned about this problem and wanted to tackle it. But when we were having the conversations on what is the best way to tackle this type of pollution, um, we ended up uh, considering not so much looking at the end of stream pollution cycles, because from our perspective, once the pollution reaches the ocean, it's too late. There's very little you can do to get it out. And not only is there very little you can do to get it out, as you've mentioned, plastics is made of petrochemicals that then break down into microplastics and other chemicals, and that's completely impossible to sort of take out of the water. Um, so we thought we are going to look more upstream to the source of this problem. Where are the stopgaps and where are the systemic solutions that can actually reduce the amount of plastics that ends up in the ocean? And where we ended up is all the way upstream in the petrochemical production, which includes plastics, um, market and supply chain. Um, but it's also a bit of a unique place for an ocean conservation funder to be. And we found ourselves in a lot of spaces where people talk about toxicity and health and food systems and climate, things that weren't necessarily our main focus, but through those conversations and through sort of the discussions with other funders, um, sort of kind of being a bit surprised at seeing us at those spaces. Um, and the more we learned about this issue, the more we realized this is truly a cutting, a cross-cutting issue that sits very much at the intersection of all these different problems of climate, biodiversity, public health, and environment and environmental justice. Um, and therefore, there's not only one solution that would work, um, definitely not a technological or sort of a techno fix. This is a systemic issue that needs to be dealt with on a systemic level and very much at the source. Um, and through that journey, we were looking at a lot of different types of work that could potentially have a systemic solution. Um, and what we found is that, first of all, this is a much bigger sort of health crisis than we've realized, that is touching a lot more of our areas of day-to-day life than we that we've previously known. But also, this is one of the issues that are the most engaging and the most sort of compelling. And we wanted to do more in the area of getting people to not only sort of worry about plastic as a waste issue, but worry about plastics as a health concern, and change some of the perceptions around plastics, sort of traditionally being more hygienic or more, that's the way to keep things clean, and and only using it once means that it's more hygienic and safe. Um, and one of the main ways that we realized that this could be done was if healthcare professionals were, first of all, sounding the alarm about the health risks of plastics and chemicals, but also proving that this is not actually necessary for safe and a hygienic treatment, that it was the opposite. And we figured, who best to sort of make this point than healthcare professionals whose main concern is actually not around necessarily the waste, but around the patient's health, and who deal with the most vulnerable populations, for example, newborn babies. And kind of to put it in the most simple terms, if a doctor can prescribe medication or provide treatment with little or no plastics, then there's really no reason for me to buy a banana that's wrapped in plastic in the supermarket. So that was the thought process, and the journey that has sort of led us to this place where we fund Healthcare Without Harm's work, incredible work, um, hoping to really sort of help to change how people view plastics and what it does to them from a health perspective.
Absolutely. Thank you for sharing. Something you mentioned was that the work that you guys do around this issue is actually sort of an unusual space to occupy as an ocean conservation funder. And I'm wondering if you can talk a little bit more about like philanthropy's approach to this issue in general, and what you're hoping to see more of from other funders on plastics and chemical pollution.
Absolutely. So yes, we do find ourselves sort of questioned a lot around the type of programs that we fund, because they don't necessarily all have oceans in the title. Um, and this is unfortunately something that we see a lot in different sort of funding circles, where we are extremely siloed in how we work and how we think. Um, if you are an oceans funder or a climate funder or a health funder, um, you feel a lot of times very limited to that area. Um, the added sort of complexity of dealing with chemicals and plastics is that it's technically very complex, or can be technically very complex, and re people think that it might require sort of a level of knowledge around chemicals and chemical compounds, um, that they don't necessarily have or want to have, and sort of keeps them away from dealing with this topic. I can say very much that we are not in any way experts in this area at all, and rely very much on the organizations that we fund for that expertise. But it's absolutely possible to fund in this space from a systemic sort of change-making perspective, um, where the changes that are needed in the system are much more simple than you would think. And a lot of times there are other forces who sort of maybe perhaps overcomplicate the issue exactly for that reason. So what I would love to see is much more collaboration from different types of funders who think of themselves as sort of a link in a chain um, of of this issue rather than experts focused very much on a specific issue, because this is a systemic issue. It affects all of us, and it affects pretty much every aspect of our life. So there isn't a lot of funding uh, areas or a lot of funding um, sort of uh, sort of specific goals that don't that chemicals don't have an impact on. Um, so I would love to see more funders sort of stepping into this issue, but through their own lens, through their own expertise, and figuring out where in the system they sit and where within the sort of place where they sit, what systemic issue they can work on that will then create a bigger change across the board.
Absolutely. I want to keep exploring this issue from the perspective of philanthropy. So, Siobhan, I'm going to come to you next. Can you tell us about your work at Savitri and also why chemicals and plastics pollution have become a priority area for you guys as a funder?
Absolutely. Hi, everyone. My name is Siobhan. I'm from the Savitri Trust. We're a small family foundation based here in the UK. For the first 2 decades, our work focused almost entirely on community healthcare in India. We had a really large focus on eye care and restoring people's sight, and we've also helped to establish a palliative care program across rural areas. But around 6 or 7 years ago, our priorities expanded, and that was really largely down to Devika, who was our chair of trustees. She recognized that if we're really serious about supporting human health, then we actually needed to start to consider the environment that shapes it. So that shift really led us into looking into environmental funding here in the UK. And through our own research and connecting with other funders through networks like EFN, we came to better understand the underfunded issues and really looked at really the ubiquitous issue of harmful chemicals. And since then, we really haven't looked back. For us, plastics and harmful chemicals do sit side by side. As we've heard, they're in our soil, water, air, and food, and even our bodies. And ultimately, they can cause real harm, especially to children who are most vulnerable over their lifetimes. So at a basic level, at the Savitri Trust, we believe that obviously things that we eat and breathe and use should be free from toxic chemicals. So really kind of what started as a £30,000 exploratory grant has actually grown into one of our largest programs now. And in the last 6 years, we've given over 1.3 million to this cause. We tend to focus on issues like strengthening UK and international law and policy, but we also do fund organisations that are focused on raising awareness about the issue and about the potential harms. So typically we fund with unrestricted multi-year grants of about 30 to 40,000 a year, although that does vary. And it's a range really. Our largest organisation that we support in this area is Client Earth, but we also do support smaller organisations such as the Women's Environment Network, which is working to raise awareness about harmful chemicals and plastics in everyday items that we all use, toys and nappies, makeup, period products, all of that. So I think for us, it's really been a bit of a journey, but I think it's a really, really good example how one person's kind of passion within a family foundation can lead you into a new space and ultimately start to make an impact within that. So, yeah.
It's a great story. What role do you think funders should help play to help solve the plastics crisis from your perspective as a funder in this space?
Okay, so I think, at the Savitri Trust, we believe funders really have a bigger role to play across all of our programs rather than just kind of this transactional process of providing the grants. The reality is, as we've heard on this session, like the plastics and the harmful chemicals crisis is really underfunded. And so over the last 5 years, what that's meant for us is it's kind of provided an opportunity for us to step into this space and help to try and strengthen our partners and build their capacity. And so some examples of what that has meant from us is really trying to openly share why this is an issue and a priority for us in our own networks. We've also done things like co-host webinars on this issue, and we've hosted events trying to bring NGOs that we're supporting and others together with other funders to try and raise awareness. We're really keen to try and proactively champion the partners' work if we can, with a view to trying to entice other funders into it. And so we have had some positive results with that, which is exciting. But yes, it's obviously an ongoing work. And I think recently we have joined in the UK. There's a group of funders that are working on this issue that are trying to come together and share information, talk about the issue, share kind of communications about our partners. And the whole idea behind that really is, again, like working together, trying to increase transparency about what we're all funding. You know, are there gaps out there that we could be helping with, and potentially looking at some type of collaborative funding possibly. So that's the kind of thing that we're looking at in terms of what we think funders can do together. And I think, you know, the reality is what we've realized over the last 5 years is, you know, this is such a huge issue and it's a huge underfunded critical point. And no one funder is going to be able to step into this and fix it, even the big ones. So fundamentally, I think we all need to be kind of working together, kind of acknowledge what our capacity is, and how we can realistically work together. So I think we're excited for that. And I suppose what we would say as a bit of a kind of shout out to anyone listening to this, we as a foundation are really keen to always talk to other funders. So if you're kind of listening today and you're thinking, oh, this is curious or something strikes a chord, and you might want to find out more about funding in this space, and it's not something that you have traditionally done, then please feel free to contact us because we're definitely happy and excited to welcome more funders along.
That's great to hear. And also just a reminder to the audience to introduce yourself in the chat and ask any questions that you're excited to hear our panelists talk about. But yeah, I think what I've really heard from you and Tamara is just really bringing more philanthropy into this space, kind of adopting a lens. And we're seeing movements towards that, I think, in climate areas. But I think this is an issue that definitely needs a lot more attention. We've heard about the health impacts and we've heard about sort of the funding space. So let's talk a little bit about action. Yuyun, I'm going to come to you now. The plastics supply chain is one of the most globalized industrial systems in the world. It spans everything from fossil fuel extraction to chemical manufacturing, product design, international trade, consumer use, waste collection, and end-of-life management around the world. A plastic bottle used for an afternoon in London might have originated from petrol extracted in Texas, processed in Saudi Arabia, manufactured in Vietnam, shipped through Singapore, consumed in the UK, and then sent to landfill or recycling or incineration yet another place. This global fragmentation is one of the reasons that plastic pollution is a difficult problem to solve. But I want to ask you how you are solving it at IPEN. What is a community-led approach that you've seen be successful in reducing plastic or chemical pollution? And tell us just a little bit about your work at IPEN.
Thank you, Elika, and thank you for having me here. Interesting to hear the previous speakers already highlighted the issues related to plastic and chemicals. If I may, I would like to share my screen so it will be a bit better to explain. Where is it? Can you see it now? Yeah. Okay. Yeah, so I would like to add that plastics is made out of carbon and chemicals, and the chemicals are a lot of them. I will explain after that. And due to the climate negotiations, now there are shifting policy or agreement globally that 30% of crude oils that used to be used for fuel are now not allowed, so reduce the fuel, the fossil for fuel. But as a consequences, that chunk of minerals are still in some countries available, the deposits, so it still can be used. And in some countries, like in the Arab countries, the Gulf countries, they call it crude to chemicals because they still have these deposits. And then in China, they started using coal to chemicals because they cannot use it again for fuel. But all these supply chains that you explained before, there are complexities in every stage. And even if we touch the issue of the chemicals, that's even more complex because when it was mixed, it's a different chemicals. And then when it's degraded, it's also could behave differently. And many studies are only looking at a single chemicals in the product, but when they becoming in the process, it mixed with everything. So during the process of manufacturing, also informations about what have been released or discharged from a facility producing plastics are still in big questions in developing countries. It's the same thing happen when it's landed or dumped in on behalf of recycling name or circular economy. There are a mix of everything. So this is the chemicals that I call it the nasty nine because it's nasty. But there are three of them that stand out. BPA has been mentioned several times. We call it everyone's chemicals because it's in everyone's body. We can find it in children, in women, in men, all walk of life. They have BPAs, and BPAs also have different families. BPA, BPS. There are lots of congeners of those chemicals, and then the second chemicals is the everywhere chemicals. We can find them everywhere, in healthcare settings, in households, and everywhere. So basically everywhere chemicals, we call it phthalates. That's plasticizers that make plastics become softer. And then the last one is forever chemicals. We know that it cannot be degraded and it's difficult to stabilize or to treat them. And then when we talk about the impact, there are a lot of stories within our networks that IPAN works in 131 countries. So we have more than 700 NGOs members, including communities and networks. There are a lot of our members live in countries as a producer, producing countries, manufacturing countries, and also the disposal countries. The issues that raised on the ground varied. For instance, the one on the left, top left, is the explosions in Malaysia. That's from petrochemical industry. So the issue of pollution in the air that affecting communities, that is one thing. And then the second in the middle is the case of pellets transported, and then the ship was wrecked in somewhere and then landed in near Sri Lankan beach and coastal area. So the response are cleanup and also litigation because it has to go to the court. And until now, it's still a lot of the decisions of the courts that the government have to do something. Also, sometimes it takes time. So the NGOs or civil societies keep pushing this to have and clean, to have the government or responsible actors to clean it. And then at the bottom, you see the smokes. This is like a war zones. It's from my country, from Indonesia. It's the tofu factories using plastic waste from the UK, from everywhere, So I saw Union Jack packaging and so on. It was like scary. And this kind of smokes also absorbed by animals, by even chicken, and in the eggs I can find dioxins in high concentrations. eggs supposed to be, especially free-range chicken eggs, supposed to be affordable and safe food, you know, but in these kind of places, you can't guarantee. And then we have on the right side to understand the exposures at workplace. We use the new methodology, new method to analyze exposures. It's using the silicon wristband, so they use it for a week, and we did this project in Thailand and Kenya, and to see the difference between the exposures in plastic recycling and just recyclers, waste pickers, and also compare it with the UN special rapporteurs, the government delegates, whether they will have different exposures or not. But apparently, both groups, even the one who works in the office, also exposed to certain type of chemicals, sometimes higher than the one in the recycling sites. And there are a lot of reports that within IPAN, the way we try to advocate and improve things is to collect data and generate data. So you can find a lot of reports on IPAN websites, how we address and raise the issue of related to plastics. There are so complex. There are so many issues, like the one on top, refuse-derived fuel. So plastic waste cannot be exported to countries anymore. So the exporting countries label it as refuse-derived fuels or process engineered fuels, or different name, but it's the same thing, you know, just chop it into small pieces and then exported it. And of course, because they use it as fuel, it will be burned, and burning plastics, meaning releasing and discharging a lot of chemicals to the air. And then yeah, so a lot of practices, including the replacement or the alternative to the problems or to the products. Many of our colleagues also working in promoting reuse, repair, and also producing bags, cotton bags, and so on instead of plastics. It's very common and easy, but it needs to be adopted by the city authorities and then the national at the national level. But yeah, so in on this website, you can find a lot of studies and data that we generated, that we try to bring the local issues to the global level, and mostly to the conventions, negotiation platforms, forums, to ask for the global change and global policy changes that will lead to global to local again. So many of the IPAN participating organizations bring back the decisions at the global level to their own countries, and then push and advocate for the change at the national level and systematic approach. So I hope that's just briefly explaining how we reacted to the issue, especially chemicals, because chemicals is not cannot be easily detected, and the capacity at the country level, especially developing countries, very low capacity in laboratory analysis. And so when we have new chemicals coming up, so every year it's about 16,000 chemicals, maybe new chemicals produced and manufactured, and some of it used for plastic productions, and still lots of unknown, because the study to look at individual chemicals as well as the mixture when they become cocktail, it's very complex. So the best way is to keep pushing and generate data, because sometimes government refuse or deny that there is not enough information or not enough scientific evidence. But citizen science can be and should be also accepted, because we follow the rules of scientific protocols as well. So by presenting more data and evidence, we hope that the policy also can change. Thank you.
Absolutely. Thank you so much, Yoon. I think there's such a important space for sort of like mapping the issue and collecting this data, and it really sort of is the foundation upon which all of the other work can be done. Joe, I want to come back to you now. We've talked a little bit about how funders are prioritizing this issue in this space. And now we've also heard about actions for working on plastics and chemical pollution. Could you share an example of the most successful substitutions or phase outs that you've seen and their impact on the environment and human health?
Yeah, absolutely. We've got a massive collection of initiatives that our 4 hospitals have put in place so far. I think for me, one of the most impactful has been from Great Ormond Street Hospital in London, where they have adopted a change in practice to switch from IV medication to oral medication. So this hasn't been a blanket case. It is more about ensuring that from a clinical perspective that care is being personalised. We're doing the right thing for the right patients and to give them the best care possible. But that has meant, by making that swap where it is safe to do so, and what they have piloted with is paracetamol on 3 wards, where it was routinely given to patients via an IV administration, which requires not only vials of medication, the syringes to draw it up, and then injecting it into a medication bag of saline, and then the plastic tubing to the cannula that is sitting in the blood vessel as well. Many of those products containing things like PVC and phthalates as well. So then they did a review and audited the times that IV paracetamol was given, and determined that a significant proportion of those administrations could be given orally instead, so either liquid or for some patients, young patients, even tablets as well. And so just changing that practice of clinicians not doing things routinely, it's got the potential of saving one ward or almost £9,000 a year just in the procurement costs of those medications and equipment. But they've also identified that it actually promotes patient safety, and when it comes to problems such as medication errors, that is more common with IV medications that have to be calculated versus weight and injected into the bag. So they've found there's potentially that reduction in medication errors happening as well, but it is also more time effective as well. So it takes more time to prepare an IV medication versus an oral medication. So it's saving clinician time as well. So in a healthcare sector that is under a significant amount of pressure for productivity, the multifaceted different benefits of making this swap, with the initial drive of it being a plastic reducing initiative that also reduces EDC exposure, has had so many different phenomenal benefits. But then there's also been some really fantastic kind of behind the scenes changes, so less about the exposure of plastics to the patients, but for example, clinical waste bins, changing from plastic waste bins that go for incineration to cardboard waste bins. Still goes to incineration, but because it's cardboard instead of plastic, again, it's reducing those chemicals, those additives, the reliance on fossil fuels, and therefore the potential air pollution from the end of life management too.
Absolutely. What an encouraging story that actually making these swaps for this ward could save funding, could save time, could improve health outcomes. I think that's really encouraging to hear as we're sort of like approaching this issue. So we have a bit of time now for a Q&A, and I just want to remind our audience that if there are things that you want to ask our panelists, to go ahead and pop them in the chat, or there's also an app called Slido, which you should be able to access. It should be in the bottom right. You can see sort of 3 boxes and a plus, and it says show app. So you can also put your questions in there. But we have a question from Michael Atkinson from Agelis LLC, sorry for my pronunciation, who asks, is there a future future where plastic and or EDCs could be considered synthetic pathogens with an associated disease designation? And Joe, I'm actually going to put that one to you and see what your thought is about this question.
So I'm just going to pull it up to read it properly as well. But basically, I think one day we could get there. I'm not sure how long that would take, but I think again, that wider recognition of the toxicity and the problems that can be caused and the threat not just to human health but to planetary health is significant as well. And I think this really aligns with another comment that I saw pop up about the similarities and parallels with the tobacco industry, and certainly here in the UK that has been significantly addressed on the health front. And yeah, I am hopeful that it will go in that direction. And currently, right now, I feel like our work is sitting on the right side of history.
Yuyan, I wanted to also ask this question of you. Is this something that you guys have sort of not seen necessarily because it hasn't happened, but is it something that you think about sort of as you're doing all this mapping of plastic and chemical impacts?
Yeah, it's an interesting question. Could be considered as synthetic pathogens associated with disease designation. Actually, some studies already shown the correlation between EDCs and particular diseases. The pattern has been seen, including for infertility, the effect to reproductive health and infertilities, and that's a lot of studies conducted by Dr. Sana Swan. But plastics has to be, we are working on, how do you call it, the alternative to petrochemicals, because the basic ingredients of plastics currently are carbon and mostly from fossil fuel. So the similar materials could be, something else that has fibers and so on. It could be from waste and so on, but it could be different diseases, from the alternatives. But right now, the existing studies, current studies already shown the correlations between combinations of, it's not the plastic itself, but the chemicals that made up plastics. So those, especially those nasty nine, that can be associated with certain diseases, but not pathogen. So pathogen is a bit different. Yeah. Thank you.
Yeah, thanks for sharing. I realize it's a technical question and also hypothetical, but I think it's interesting to think about. The next question comes from Natalia, and I'm going to put this to Siobhan and Tamar. How are you collaborating among funders on the plastics issue? Do you share best practices, solutions, successful projects, things like that with each other? Or maybe Siobhan, we can come to you first.
Hi, sure. Well, yes, this is on a number of different levels, and Tamar's been doing an amazing job of collaborating and bringing funders together. I think, when we first started funding in this issue, we kind of were working probably quite alone. I mean, it's been really exciting, dare I say, over the last couple of years, to be coming together with other funders working on the issue, and that could be of a variety of different sizes. And resource and ability. And I think this is the direction we need to be going in. I think lots of us bring different things to the table, and it's better to all work together. So yes, in terms of what we're doing, it is about kind of just sharing information, sharing, talking about partners, trying to connect people with other partners, shine a spotlight on different things. And I would hope that there is the potential moving forward for maybe some funding collaborations, depending on what we're talking about, but it is quite early stage in the UK, in all honesty. But yes, exciting times ahead, hopefully.
Tamar, do you have any thoughts to share on this one?
Yes, so as Siobhan mentioned, at Flotilla, we were very much sort of preoccupied with this question as well, and kind of thinking to ourselves what our role can be sort of outside of just grant making. And we sort of come to the conclusion that we can help be conveners and sort of bring people together around this issue. We actually host a yearly meeting called ChemCure, which is meant to bring together funders, as Siobhan mentioned, of different sizes, but also different areas of focus, and to sort of bring them all together around this issue, and to, of course, share information, share examples, but hopefully also we'll be able to kind of take it forward and create actual sort of tangible collaboration opportunities, actual sort of potential strategies that can help bring people in or sort of further their own grant making on this issue. I think, especially since this is such an underfunded issue, we must sort of all work together to make the most of our funding and our leverage. And we can, even though this is an underfunded issue and a very big problem, we do have the potential for an outsized impact on the systemic level if we collaborate and coordinate with each other. So that's kind of what we're trying to do. And if there are any funders out there who are interested in joining us, they can feel free to contact me. We'll be very happy to have them.
Yeah, I think what I'm hearing is there's just so much space for action here. We've got another question in the chat from Neris Wellfoot. Apologies for my pronunciation. I'm gonna, I think, address this one to you, Yoon, and see what you think. They ask, do you favor working with individual governments on policy work, or do you see value in supporting a global plastics treaty to tackle the problem of the impact of plastic on health?
Yes, thank you for the question. I prefer both. So because we have to address this issue, we have to work at all levels, local, national, regional, and then global, because it cannot be solved only at you know at the national level or at the global level. But we have to tackle all levels. Although it's a bit challenging because sometimes, for instance, the African region, at the regional level, they are very strong when they come together at the plastic treaty negotiations. But there are a lot of countries also, we call it like-minded countries, that the petrochemical countries, that's still blocking and trying not to have any agreement. It was frustrated for us last year or 2 years ago. So we have a stall negotiation because some countries insisted to have only the downstream treaty, not talking about upstream, but because they still want to produce and use their remaining resources. But as the experience from other conventions like Basel, Rotterdam, Stockholm's, Minamata, that related to chemicals and waste, there are some issues already addressed related to plastics in the existing ones. So that also can be used as the forum or arena to address certain policy topics, like the chemicals, plastic chemicals, some of them already regulated and controlled under the Stockholm Convention. But some others that are not persistent organic pollutants have to be discussed in the other forum. So it's a bit tricky, but we need to do it at different level and at all level, because at the local level, for instance, it's very easy to lobby and approach government to have the single-use plastics prohibitions. And that's if it's adopted at the national level, then from the national level, it has to be implemented at the subnational and city level. So that's one level. And then at the regional one, for instance, ASEAN or in Africa, they have the decision-making process under the African Ministerial Environment Network. That will be also applicable for the African region, and for Southeast Asia, it's under the ASEAN agreement. So at different level, we have to keep pushing for something. And I learn more and more that if the civil society do not shout, do not scream, do not kick, do not provide evidence, sometimes the governments will be conveniently sitting, so we have to keep pushing at all level. But to address the plastic upstream level, it has to be discussed at the global meeting. So plastic treaty negotiation is important.
Absolutely. We are coming up on the end of our hour, so I'm going to ask one more question, but I'm going to ask it of everyone before we wrap up. If there was a major action on plastic and chemicals pollution undertaken this year, what would you want it to be and why? So I'm going to start with Joe, and then we'll go around.
Yeah, I think from my perspective, similar to what's already been spoken about when we think about plastics and supply chain and looking upstream, within healthcare, there's often a saying that prevention is better than a cure. So reducing reliance on plastics, reducing exposure to EDCs, is kind of that preventative aspect of public health priorities that are happening as well. So then for us as an organisation, Born Green Generation, we are at the point of scaling it up. We've got this proof of concept. We have tested and seen what works, and we are proving that healthcare can be delivered in a safe way without as much reliance on these harmful materials and as well. And in order to kind of like build upon that impact and generate more awareness amongst clinicians and equip more clinical teams to adopt these principles of our project, our plan is that we want to reach 5 million babies with lower plastic hair by 2030. And in order to do that, we need kind of that additional support. We need that growth in order to facilitate more hospitals to adopt these initiatives and therefore protect the health of their patients and their communities as well.
Thank you. Tamar, let's come to you. What major action would you like to see this year?
My answer is a bit more conceptual, but I would like to see plastics, chemicals, toxicity sort of become a central topic for every funder working on any issue, to sort of look at and discuss how this relates to their area of funding. Kind of similarly to the climate issue, this is something that sort of goes beyond a specific environmental problem. This is a day-to-day issue that needs to be discussed and incorporated into every conversation that we have with our board, with our grantees, with our colleagues. And I would very much love to see that happen more and more.
Thank you. Siobhan?
Oh, sorry. Yes, I think very similarly, if I was approaching this more with a funding lens, ultimately, I would really like this to stop being seen as an underfunded issue. It's been underfunded since we kind of entered the space 6 years ago. I'd like it to become a major priority, and I'd like to see bigger funders coming into this space and other funders like us joining us. And then fundamentally, in 2 years' time, whilst it will be a major issue, hopefully we won't still be describing it in that way. That would be good.
Thank you. And Yuyun, if you can share your closing comments, if there was a major action on plastic pollutions undertaken this year, what would you want to see?
Yeah, plastic pollution, it should start from the upstream. So I hope that currently actually there is a discussions of the head of delegates on plastic treaty negotiation in Kenya, and it's a bit okay because a lot of interest information and transparency are lacking. So I hope that this year and also the coming year, in March, there will be the next negotiation of plastic treaty. We hope that we will see more transparency in the process, and including observers, civil society can get involved and participate and listening to the conversations, because we don't want decisions made behind the door because all of us already affected right now. So there is no point to hide all the negotiations and the conversations behind the door. We would like to have more transparency, especially because this will be affecting our lives and the future. Thank you.
Thank you. And thank you, everyone. That's all the time that we have today, unfortunately. I hope you've enjoyed today's discussion. And if you found it helpful and engaging, don't forget to subscribe to Alliance. And don't worry if you missed the offer during our event today. We'll be sending out emails to you shortly that has the discount code, as well as a recording of this digital event to everyone who registered. I'd like to end by saying thank you to our panelists, Joe, Tamar, Siobhan, and Yuyun. Thank you to our partner, Healthcare Without Harm Europe. Thank you to the Alliance team for producing today's event, and thank you to all of you for being part of the Alliance community today. Alliance's next 2 digital events will take place at the end of this month. One will focus on youth, and another will look at telling the global philanthropy story. So make sure you're signed up to our mailing list so you don't miss the invitations. Thank you for joining us, everyone, and see you next time.
Thank you, Erika. Thank you, everyone. See you again soon.